I want to add my welcome to Beth's welcome to Des Moines. She said, I'm Gerd Clabaugh, Director of the Department of Public Health, and I'm pleased to be here with you. And I have to point out, too, I'm a proud past president of the Iowa Public Health Association. There's a few others in the crowd here as well, so I appreciate I'm in a very good group with a good group of friends. So again, thanks for taking the time to be with us today. You know, I know that this is kind of a serial set of meetings over years, and so this is really a terrific opportunity not only to be in Des Moines, but to get back together again and talk about topics that are important to Federal Region 7. We've got a lot in common in the region, and so this is just a great way for us to engage as a group here in the Midwest around topics that we've got common interests in, and particularly have an opportunity to talk about how we're responding to those issues in the Midwest. And I'll add to Beth's thanks as well. Thanks to Beth and the whole IPHA group for pulling this together. This is always a great opportunity, again, to get people from the region together. And want to thank members of her officers group as a part of the board, Sherry Marine, the president-elect, Deborah Thompson, our secretary, and Bonnie Rubin, who you met at the registration desk, is the treasurer. And thanks to the University of Iowa for opening up this space, a really great educational venue for an opportunity like this one. I think that we all know that public health is going through continual reevaluation and change, and sometimes even that acknowledgement gets exhausting. Many of you have been around as long as late 80s when we were talking about the future of public health version 1, and it seems as though we are in continual reevaluation of the work we do, and I think that's good. I think that's good. We're focusing on continuous improvement. We're thinking about responding to the needs of our communities, and we know that those needs are changing all the time. At the Department of Public Health, we're working hard to emphasize the role of quality improvement in our work, equipping our staff with the tools that it takes to make us a continuously improving department, as well as focusing on improving the programs that we have that support Iowans and improvement in their health. Part of that work revolves around our efforts to become Iowa's chief health strategist, and I know that that's something that you all are familiar with, that primary point of entry for our public and other elected officials to look for health information, data, best practices, and look to public health as a leader in that way when it comes to strategies to improve the health of Iowans. And so we're working hard to really own that title for ourselves in Iowa. IPHA is a professional development resource for advancing the capabilities of our staff to serve in that key role. And so this two-day meeting will also serve that purpose for all of our public health colleagues as we look to advance key strategies that are focused not only on improving the health of Iowans, which is some of our interest, but really improving the health of Americans and Midwesterners, particularly in Region 7. So thanks again for being here.